You guys want to come see abdominals, and then you can practice on yours.
Okay, this is cat dissection abdominals.
Okay. So first of all, cats have lovely serratus anteriors, and if you find that first, then that'll give you a reference point for your what? What's going to be inferior to that serratus anterior? What's the next muscle down on people? Oblique. Which one? External. Okay. So here's, look at the serratus. Look how pretty these are. Very obvious. They look just like the pictures. It's nice when that works. And then, so this next muscle here is going to be our external oblique. So another way we can check that is look at the direction of the fibers. Okay, so what did we learn about direction of the fibers in the external obliques? Right? Externals go this way, and the internals go this way. Right? Okay. So if I stretch my muscle out and I look closely, can you see the fibers or fascicles? These are technically the fascicles. The fibers would be the cells themselves, which we can't really see with the naked eye. But these are the fascicles, and they're going the direction we expect. Okay. So what we want to do is get to the next layer, but because they're so thin in the cat, you will miss them if you use a scalpel. So what we're going to do is we're going to go to where the rectus sheath is, which will be medial on the cat here, on people too. This cat, someone noticed, he's got a little fatty tumor here. Someone was asking what that is. So my guess is he might have been a little bit more of an aged cat. They tend to get fatty tumors when they're older and also have an enriched diet of some kind. So anyway, or it could have been a remnant of a little hernia, I'm not sure. But my favorite tool, the dissecting needle. So we go where there's white connective tissue, which is tough, so I'm probably not going to do a lot of damage. And I'm going to tease along the white near the edge of this external oblique muscle that I want to get to. Now, once I've teased some of these fibers apart, now I can either use my fingers or a forceps, and I'm going to try to gently or kind of gingerly grab that external oblique. Now I've got some fibers separated here. I could take a little scissor and just do a little snip. I'm not really cutting into the muscle itself, I'm just snipping some of these fibers that attach it. And when I peel this back, I think you're going to be amazed at how thin this is. Okay, and so I need a little more of this tough stuff out of the way. I'm going to tease right here a little bit more, and I'm going to pull. I know not everybody can see quite yet, but stay tuned. The exciting parts will be revealed any moment now. Okay, so we pull back on this. Look how thin this layer is. I know that this might affect some people's appetite, but I equate everything with food, so it's kind of like you go to the deli counter. How thin do you want your shaved ham? Okay, so this is very thin, like those very thinly sliced meats. Okay, so I'm going to gently pull. Now our white material, I talked to a couple of groups about this. What is this spider webby white stuff I'm seeing? Loose connective or areolar connective tissue. It's pretty easy to separate. And this white, the really white stuff, is the dense regular. It's a lot harder to separate. So what we want to get to here is, I may even have both layers here actually. They may even be thinner than that. Yeah, it is hard to separate. We'll get the fascia off of here and we'll see.
If you look at the underside, you'll be able to see which way it's going. Right?
We'll pull it back. Yeah, looking at the underside is a little deceiving though, because when you flip it over, your brain doesn't always flip it over for you. So you're not always... Okay, we're good. Okay. I'm tearing my oblique a little bit to get it pulled back here. Now, here is another layer. Okay, what direction are my fibers going? Okay.
Up and toward the spine.
Okay, it's going this way. Now, this is still going, yep, so this is our internal oblique right here. Now we need to get down to one more thin layer, go through this and get to our next layer down, which is going to be our what? What's the next layer down? So I'm going to go where there's white here. I'm going to... Nope, that's going to be up here. So we've got external obliques, internal obliques, and then the one that goes this way. Transverse. So the transversus abdominis. Some people leave the us on transversus, and some people just say transverse abdominis. Either one's really okay. Peel this one back. Maybe. Now you can really see the fascicles. We're so thin, we're almost to a single layer of fascicles. And if I grab my forceps and I pull some of this muscle out of here, sorry, you have to be a little gingerly here. You go all the way down into the peritoneum, which we're trying to avoid. Okay, so we pull that back. And underneath that, we should see some more muscle, which it looks like we do. See a little bit more muscle under here. Okay, and it should be going a slightly different direction, which in the cat, it tends to look a little bit like the external oblique. It doesn't go quite straight across. It comes at just a little bit of an angle to curve around that abdomen. So if I look at the fibers now, someone can look closely. It's kind of hard to see on here. Now these fibers underneath this single thin layer are going this way. So we came this way, then we come this way, and then we come this way again. It really should be like more straight, but because the belly is round, it appears that way. Now I'm going to try and go right to the peritoneum so that you can see, you'll be able to see into the abdominal cavity. There, right here you can see the transversus better. And then this is the internal, right here. Very thin, hard to keep it intact. Okay. Now I'm going to try and go down and see if we can get to this peritoneal layer. I'm going to go back over to my rectus sheath. See where the transversus abdominis is attached medially at the linea alba. That's the white connective tissue underneath the rectus. Okay, I'm going to tease that a little bit. I got to be really careful here or I'll go right into the abdominal cavity. Oop, I bet I did. Oh yeah, that is the peritoneum right there. That would explain that. Okay. Let's see if I can peel just a little bit more of this off of here. I made a little puncture, which is not a big deal. But this is actually peritoneum, and you can see, I'm going to flip the cat a little bit so everybody can see better. You can actually see the intestines right through that. The peritoneum is basically a thin layer of connective tissue, and then serous membrane, which is just a few layers of epithelium, squamous epithelium. So and look at the intestines. You can see, you can move this around, you can see the different colors in here of the folds of the intestines, some blood vessels. Sometimes you can see some coagulated blood. Sometimes you can see some other organs in there. But that's how thin these layers are of the muscle in that abdomen. So, good luck. You want to give that a shot and do a little practicing with your technique. How do we turn this thing off?